Today we are going to teach you how to do a wet prep and why it's important. Basically, a wet prep is a sterile swab of the vaginal discharge viewed under microscopy. This is an important and very simple test to quickly support clinical diagnoses of vaginitis. It is much quicker than sending samples to the lab. Training is quick and simple, and supplies are relatively cheap. A wet prep is done when there is a complaint of vaginitis or noticeable discharge on exam. A sterile swab is used to sample fluid from the posterior fornix during a pelvic exam. The swab is then placed in a test tube and saline is added. Once in the wet prep room, wear gloves. A sample from the test tube is placed on a slide and covered with a cover slip. Using a 40 power lens, the sample is inspected for epithelial cells, which are cells that will have flat, clear, and crisp borders, yeast, which will be budding and branching, clue cells, which will be cells in which bacteria obscures the borders, trichomonas, in which you will see moving flagella, and the cells are slightly bigger than white blood cells. If bacterial vaginosis is suspected, a vaginal pH collected during the pelvic exam and a whiff test are performed. A few drops of KOH are added to a test tube. If positive, the odor of the tube will change to a fishy smell. If yeast is suspected during examination, then a KOH prep is used. A slide is prepared in the same method as before, then a drop of KOH in the brown bottle is added. This allows the branching hyphae to be visualized. And that's how you do a wet prep. Place a sticker in the book with your findings, then come tell a resident. And remember, if you are unsure at all about what you see, ask for help. We would be happy to show you. Remember, do not perform a wet prep without gloves. Do not eat in the wet prep room.